Hi, my name is Jody McGuire, and today I'm going to be doing my how-to speech presentation. I'm going to be teaching you how to do a CMS assessment. CMS stands for circulation, motion, and sensation. And as nurses, a lot of times we will find patients who are bedbound either because they've had surgeries or they're experiencing a fracture or a break. It's very important when you have a patient who is bedbound to check circulation, motion, and sensation of the lower extremities. These patients are at high risk for DVT, which stands for deep vein thrombosis. So this is how you would do a CMS assessment. You're going to approach your patient, and the first thing that you're going to do is your visual assessment. So when you look at the extremities, you're looking for color, you're looking for size and shape. You want the legs to be symmetrical. You want them to match. You don't want to have more swelling or less swelling on one of the extremities. And this patient has very good skin color. There is no swelling or edema noted to either extremity. Then I'm going to ask the patient, that's my subjective assessment. I want to ask the patient, are you feeling any pain or tingling in your lower extremities?
No.
The patient is not experiencing pain or tingling in the lower extremities, and that's a good sign. The next thing I'm going to do is I'm going to touch the extremities. I want to feel for the temperature. The temperature should be even and equal on both legs, and this patient's skin is warm and dry to touch. And the temperature is even on both legs. The next thing I'm going to do is I'm going to assess the pulses. And when you assess the pulse on a lower extremity, you should assess 3 pulses. You have the one behind the knee, which is called the popliteal. Then you have the tibial, which is inside the ankle. And then you have a pedal pulse, which is at the top of the foot. When you assess the pulses, you're going to start at the popliteal and you're going to check and feel for a pulse. You can use your middle finger to do so and just reach behind, and you're going to feel the patient's pulse. This is a strong pulse. And then I'm going to check on the other leg, and they should be both equal. And this patient has strong pulses on both legs. Then I'm going to come to the tibial, and I'm going to check, and I feel strong pulses on both, and they're both equal. Then I'm going to check pedal pulse, and they're both strong and equal. The next thing I'm going to do is a cap refill. So what I'm looking for is a capillary refill in the nail bed. So when you look at your patient's nail bed, you'll see that it's pink. When you squeeze it, it's going to turn white, and it should come back to pink in less than 3 seconds. Again, I'm going to go to the nail bed. It's pink. I'm going to squeeze. It's going to turn white, and it should come back to pink in 3 seconds. So this patient has good circulation in both of his lower extremities. The last test that you can do is called a Homans Signs Test. And what you do is you're going to, with the leg extended, you're going to flex the foot backwards so the toes are facing back to the patient, and you're going to ask, are you experiencing any pain in your calf?
No.
This patient's not experiencing any pain. In a patient who's having a DVT, a positive Homans sign would show as pain in the calf. They're going to have severe pain back here when you do this. So again, you're going to lift the leg, have it extended, you're going to flex the toes backwards towards the patient, and you're going to ask them if they're experiencing any pain. Are you having any pain?
No.
This patient is not having any pain. So this completes our CMS, or circulation, motion, and sensation assessment on our patient. And please remember, as nurses, it is very important that we do check the circulation on our patients.